Well, good morning, everyone. So great to be here. I don't know about you guys, but I am so excited to kick off this year's IEX with this rock star group of leaders that we have up here on this stage. So how about another round of applause for all of our amazing leaders from OHIL, OIT, Digital Health Office. So I've been joking since I've gotten here that someone decided to let the introverted night owl lead an early morning panel at the beginning of a conference. But however, despite the fact that my phone didn't charge last night and my alarm didn't go off and the coffee machine in my room doesn't work, I am still extremely excited to be here on this stage this morning with this group of folks to talk about some topics that I think are incredibly important to all of us up on this stage: innovation, technology, and collaboration. So all of these individuals play such a crucial role in those three topics in VA. So I'd like to hear from each one of them a little bit more about their role and the role of their office in innovation in VA. And unfortunately, Nadia, I know your throat's not doing well, but I'm going to start with you.
Thanks, Caitlin. Apologies in advance for my voice here. Just started losing it last night, and my coffee maker did not work either, unfortunately, so I could not make tea. But in any case, my name is Nadia Smith. I am the Acting Chief Digital Health Officer for VHA. The Digital Health Office is a brand new program office that was established in June of this year. We have teams coming in from the Office of Connected Care, as well as the Office of Health Informatics, the National AI Institute, Strat Lab, which includes some of the immersive work that Caitlin and Anne and others have been leading. We also have a new functional team that we're establishing. We're calling it the Digital Health Experience and Product Delivery Team, also known as DHXP. And really the focus of that team is to scale our digital innovations across VHA, focusing on user-centered design, research, and product management methods. So thanks for having me today.
And Angela?
Thank you. Good morning. Can you hear me? Good. So Angela Gant-Curtis, dual title. I'm in the Office of Information and Technology. I am the Deputy Chief Technology Officer for Innovations and Emerging Technologies, and also serve as the OIT's VA Innovation Unit Director. In my organization and my role, I came about individually some 6 years ago. VHA Innovation Ecosystem came to IT looking for help with the amazing innovations that you on the front line come up with every day, and being able to successfully move those from your area and VHA and scale those successfully, right? So they got me for that. And so in that role, we help do several different things. One, make sure that you always have an environment to host and pilot and test out solutions. We also help you with deploying and developing solutions. So have a technical team that's always there to help you with moving those things along, creating processes, and then working collaboratively with OHIL, Dean, and VHA Innovation Ecosystem for how do we continue to do more of that, particularly in these lean years where we have little funding and not enough people, right? So when you think about the size of VHA, where there's hundreds of thousands of you, there's not enough of us in IT to support you. So we're constantly looking for strategies for how we can do more with less and still be impactful in using those solutions that you all come up with because you know best, and enabling you to do that every day. Thank you.
Thank you, Angela. I know firsthand that we are so grateful for all the collaborations with your group, without a doubt. And I know, Dr. Zhang, I think we had you next, but if Dr. Kirsch would like to go next in our line here, you're welcome to.
Thank you. Thank you. I'm happy to do so. And in the spirit of collaboration, my coffee maker does work, so I can run to your rooms if you'll just let me know tomorrow morning.
Right. I'll be there bright and early.
Yeah, it was used quite a bit this morning. But I look around the room, and I'm really impressed and grateful to be able to be here and share some insights. I have a fancy title, working for Dr. Clancy as the Deputy Assistant Undersecretary for Health, for Dean, Discovery, education and affiliate networks. And it really means that we oversee research, innovation, health professions training and trainees across the country, as well as community partnerships. And I'm really looking forward to sharing some of what I've learned in the VA. I'm from the Cleveland VA, and I think Mary Julius is out there somewhere, anyone else from Cleveland, and grew up there for a long time and learned quite a bit about innovation from the Cleveland VA.
Thank you, Dr. Kirsch. We're so glad that you joined the OHIL team. And Dr. Zhang.
Hi, everyone. I'm Mark Zhang. I don't know if my coffee maker actually worked or not, but I am the Chief Innovation Officer for the VHA, and as part of innovation, part of not knowing whether the coffee maker works or not is just making sure that many of you have many options for coffee. So I thought different. I got Starbucks, but there's also incredible coffee here, and I just want to say thank you all, truly, thank you all for being here, because really, innovation, we are all very privileged to be able to work in the field of innovation. And I have the privilege of working with everyone here on stage, but many of you. And it's been one of the greatest privileges of my professional career. So my group, the Office of Healthcare Innovation and Learning, really oversees and supports what I think of as one of the core missions of innovation for any organization. And that's supporting hopes, dreams, and the future for veterans, our staff, the organization, and frankly, some of the things that VA innovation has already done before many of us even started our careers here have affected mankind. So first liver transplant, the nicotine patch, pacemaker. I mean, these are incredible things. The barcode. I learned about new things that VA has contributed to the world that are just incredible. And we have the privilege, all of us here, to be able to take part in kind of forging that new future. So thank you all.
Well, I would say hear to that without a doubt, and I'm pretty sure the Starbucks coffee worked a lot better to get your brain working, because that was well said. So good job on getting the Starbucks. So I know, in kind of in line with the theme of this conference, we know that collaboration is so incredibly important to the work that we do in healthcare, no matter where it is in healthcare. But especially when it comes to innovation and technology, collaboration is incredibly key to success. I know from my own extensive experience with immersive technology, if people don't feel supported, if there's not adequate collaboration, it will fail. I bet a lot of people in this room have probably seen that happen. But gratefully, and I know the culture of the people in this room know that we are creating a culture of collaboration, and not just as a buzzword, but as a day-to-day practice. And the people on this stage know that, because all of us collaborate on probably an almost daily basis in some capacity. So I'd really like to hear from our panelists up on the stage about how they view the intersection of the various offices that are represented here when it comes to collaboration to improve the future of VA healthcare. So with that in mind, I believe, Angela, I'm going to start out with you.
All right, thank you. So I'm super excited to talk about this particular area of focus. So like most of you are frontline, you're interacting directly with the veterans. You're coming up with ideas, solutions to provide better care, better access to care, better outcomes. And so my focus is on you, right, the frontline employees, because you guys have the veterans. I do that too. But I also want to make sure that your ideas actually have a chance to be successful, right? And that we have a process that we're able to help you bring them in, to test them out and pilot them, and then to move them through to a decision for scaling and doing that successfully. I mentioned earlier that we don't have enough resources, both people and money. And so one of the things that I do in collaboration with the offices here is start talking about strategically from the point of your idea. How do we make sure that we can have it enduring and lasting, right? So think about when you buy a car, right? How are you going to pay for that car beyond the first year, right? So you have the down payment, You have the card, you're taking it home, but you've got to make sure that you're able to make the payments constantly. We have to do that with our technology solutions as well. So coming up with smart ways in how to do that, as well as how do we scale them into systems that are enduring. And as an example, we had 5 innovation ideas come in at once, right? So how do we support all 5 of those? And how do we keep them going? And so some of the conversations that I get to have and help you successfully navigate the IT space is, how do we reduce our technical debt and footprint, right? So instead of having 100 different systems that we've got to have information system security officers, authorities to operate for, which is a lot of administrative overhead, and making sure that we constantly keep those systems patched and updated with changes in the software for security purposes. Let's figure out how we reduce our footprints and consolidate those under a single system of systems, if you will, that we're able to do more of that, support more of your ideas and systems as opposed to individually. We're much stronger as a team. We're much stronger when we consolidate our efforts to actually build things and keep them running successfully. And so in addition to creating a process where you're able to reach my team and help you go through that, also consolidating the almost 40 years of information that I've gathered in working in the federal space, most of that VA, so that you all can serve as force multipliers for us, because there will never be enough of us to kind of hold your hand and get you through it. So we want to get the information out to you so that you can do it successfully, or to my partners in OHIL, so that you all can use that information to wash, rinse, and repeat, and constantly bring in the best solutions that allows us to see more patients, to provide better outcomes for them, and to engage the patients in the process as well, both virtually and in brick and mortar.
Can I comment?
Yeah, of course.
My comment to Angela is, and this was not rehearsed prior, but that I've been taking a course recently, and her vision and the way that she's describing the way that information technology infrastructure is headed is the way the best of industry is doing it. And Kurt Delbene, who previously came from Microsoft, knows that, and that will enable us to really be successful into the future. So I appreciate you sharing that vision. I wanted to share those of you. I'm a primary care doctor by background, so it's been a big learning curve in the technology world. Although, can I keep going on that then? As Caitlin knows, and Ann Bailey, I've been really jumped in about 2.5 years ago, have loved every minute of it. It's the next iteration for me coming into the dean office of how do we incorporate technology and technologists into the mix of how we do things better for patients. Commenting on the collaboration piece, I've had a lot of different jobs in the VA, and as my patients used to say to me when I was their doctor at the Cleveland VA, you give it to me straight, doc, give it to me straight. And straight up is that these offices, and I have the privilege of being Mark's supervisor, and we really collaborate a tremendous amount, and we do as well, but it is a partnership with us, and it cannot be done without the innovation ecosystem, the NICE network, the SLICE network, and these different field-based innovators, all of you. There's no way. I helped to really lead and scale the group practice manager effort, clinical contact centers, shared medical appointments. It started ground up, and some started from the top with a mandate with the access crisis. Caitlin and Ann and others, Evan, have started ground up, and then the important part is that it then meets with us who can support and give leadership around some of these really technology or field-based innovations. It takes that level of collaboration if we want to say out loud that immersive technology is the way we do our business in the VA. If the way that we deliver care includes the use of AI everywhere, and it's available to all veterans, we have to have that top-down and the bottom-up piece of it. And the last piece of collaboration that I really want to emphasize is, in all of these efforts, weaving in veterans into the way that giving their feedback. We had a just sitting there waiting conversation that was phenomenal about veterans and AI and what will they want and how can we deliver products for veterans. And everything that I've ever done that's been successful, veterans who are employees, they use the VA and count as veterans and feedback, right? Getting feedback from significant others and that use the VA, Caitlin,
Yeah.
about what's working, what's not, and what they need. So that really, that collaboration, it's not just words. I can, speak about that with any of you, that it really works if we want to have a system where we make these technologies and innovations available everywhere.
Well said, Dr. Kirsch. And I know, Dr. Zhang, Nadia, you're both somewhat newer to the VA and the roles that you have, so I'm very curious to hear your thoughts as well on this intersection, especially from a new vantage point.
Yeah, especially as a new kid on the block. The digital health office has had to really define how we're going to engage with these offices. And so, apologies, guys. OHIL, Dean, ORD, they've been instrumental in identifying a lot of these early stage digital innovations. They've got, some great existing platforms, ecosystems, in order to identify and test a lot of these early stage products in the environment. And so our role within DHO is really to partner with OHIL and Dean to identify what are those early stage innovations that we want to start to invest in and scale at large. And once we start to prioritize those investments, we're going to be working closely hand in hand with OI&T because we're not going to be able to scale anything enterprise-wide without our partners within OI&T. Bringing them to the table early on so that they're aware of what our priorities are from a digital technology perspective within VHA, and so that we are all in partnership as we start to roll out these products and services across the enterprise.
It's a good vision. We like that. Collaborative from the start. Dr. Zhang, anything that you'd like to add to this intersection discussion?
Caitlin, actually, I think saying intersection is so important. So, not that I'm counting, but I'm 10 months into this role, and I think that the interesting things happen at the intersections of intersections of intersections, and part of the reason why we wanted to kick off IEX with this panel is that this is how we get to interesting things by collaborating with our partners at Digital Health Office, at OIT. Dr. Kirsch, first for the record, for the rest of the panel, as my boss, and Caitlin, 50% of the people on this panel are essentially working for you, Dr. Kirsch. So I think you can interrupt whatever you'd like, is basically the long and short of it. I think that we have to interact and engage and collaborate with everyone on this panel, but frankly with so many other people across VA, across the Fediverse, across private industry, academia, to make interesting things happen. Because it's really about those intersections. You can't do it without that.
Couldn't agree more. I know from my own experiences, even in the past year and a half, trying to figure out the way to get immersive technology devices into patients' homes. VA Immersive has been working on that. Just that, which, in theory sounds simple, right? But it involves prosthetics, it involves our office in OHIL, it involves privacy, ethics, like all these different people need to come to the table and discuss their piece of that puzzle. Otherwise, we don't have a full puzzle. We can't figure that out alone. So those intersections where their work intersects with ours is always going to be important. Now, with those intersections in mind, I think this is going to be really exciting to hear from each one of you as well. Where do you see things moving in the future? What new emerging technology, what innovations, and what are you most excited about? So, Dr. Kirsch, I want to hear from you first.
It's tough to pick.
I know.
And I do think there are innovations outside of technology. I can't think of them right now. Just kidding. Honestly, there are phenomenal innovations that are out there. I ran into a gentleman, Carl, who has a lockbox for patients to prevent suicide. And it has no technology involved, and it's phenomenal. So truly, there are examples there. But I've been really digging in deeply in the AI space so that I can really understand as it relates to value-based care that I've been a little bit involved in, and as it relates to aspects of innovation, how do we use AI? And so my excitement comes from about 45 minutes ago when I happened to sit next to Angela and talking later this week on shared decision making for patients using AI. And I've been trying to learn and look this up and see what that looks like and who's doing it, and we're not there yet. But won't that be amazing? My two examples of that are to think about it as it relates to cancer care. You have the micro data of a tumor, its characteristics. You can even simulate and model progression there, and then pull in data around the medications a patient's on, pull in family support, pull in social determinants of health of where that patient lives, and if they have transportation. And that, to me, and that intersection, and having providers, clinicians like you and me, Caitlin, working in a different way, helping to support patients, and making it easy is why I had that conversation with Angela. How do we move data in a way and put it together with Angela, with Nadia and the digital health office to do something that is impact at the patient level? So that is really, you have to be open to it, but 45 minutes ago I just turned to Angela and said, hey, what do you think of this? And that's what I hope that you all think about and do in the next 2 days. So maybe you just felt like you wanted to just ask a question to somebody and think about how that might lead to something that you really get excited about that can really change healthcare for veterans and clinicians.
Absolutely, and I think that's great advice, and the perfect advice for an innovation conference. Start a conversation and see what wild ideas come out of it, and where that takes your brain later and the work that you do. Dr. Zhang, I'd love to hear your follow-up on this question as well. What are you most excited about? What do you see for the future?
Yeah, I think there's just so much potential with emerging technologies. I could name one, I could name two. There's so many new future states that are going to happen. Clearly, every year, technology becomes more and more important to just the fundamental bedrock of both our society, but certainly healthcare. And I'm going to take a different tack. This is the innovation pathway, right? I've been clinically practicing as an attending physician for about a decade. And all in 15, 14 years, something like that, with training included. When I started training, I was still trained on pen and paper. I learned how to write a full notes, full H&P, all that. There was like bonus points, brownie points, if you could write a H&P and fit it into one page. Some of the real ones know that, right? Like, you know this. You had to write orders on paper and give it to someone. You had to call a transcriptionist for history and physicals and discharge summaries. And it was kind of an incredible time to practice, because when you were doing a history and physical and you forgot something, you could say, oh, you know what, actually, can you add so-and-so to the allergies? And then 24 hours later, it would be up, and it's perfect. In 15 years, so much has changed. That's incredible, right? Part of the reason I'm physically here is that I just had the luck of training during the time when the iPhone was released. And I remember seeing the first iPhone and thinking, holy heck, that is going to change how we practice medicine. And it has. So I think the thing that's most exciting to me about the future is that look what's happened in 15 years, in 10 years. What's going to happen in the next 10 years? And as we think about hopes, dreams in the future, that's what this office, innovation, in collaboration with our partners, that's what we get to do. What a privilege.
I feel compelled to share a moment when you were interviewing for the position, and we said, what, Dr. Clancy? And I said, why do you want to come to the VA? And you said, because I really feel like I can make an impact there. So it really is really a pleasure to be able to incorporate what you've done at Harvard, Brigham, and how you've thought about work outside of the VA and bring it in. You know, we are all lucky that we have you here to help think about how we pull all these pieces together. So,
Wow.
Absolutely.
Well, thank you. I'm just glad to be here, and 10 months in. So give me at least another 10 months, and we'll see where things are.
Yes, welcome to this. We're very happy to have you, Dr. Zhang. Nadia.
Yeah, so I am excited that we're actually putting the collaboration in action as we speak. And so, especially in the area of AI, so Dr. Kirsch mentioned that, I think a lot of you have heard that the VA, starting last year, embarked on this AI tech sprint, really focusing on reducing provider burnout, administrative burden. I think there were well over 150 vendors, that submitted their products, with the leadership of Dean, OHIL, ORD. We were able to test those solutions rigorously in a simulated environment, and came out with a couple winners a couple months ago. And so with DHO, what we're doing right now is we're taking the results of those We're taking the results of those tech sprints and piloting them across several facilities, and getting them actually into the hands of our providers when it comes to the ambient scribe piece of the tech sprints. We've got our leaders, Sue Shaisi in the audience here, who's leading that effort along with Donna Hill and David Hook and Evan Carey and others from the National AI Institute. But we're excited to embark on these pilots and working again closely with OINT and Octo in terms of evaluating what are the technical requirements and specifications that we will need in order to roll them out enterprise-wide when we're ready to do that after the pilot phase. So we're already collaborating, that's already in action, and so I'm really, really excited to see that come to fruition.
That's a great example. That's very cool. It is great to hear about, so thank you for sharing that. Now, Angela, I know you have definitely been living in the world of definitely technology and innovation. So I'm curious, with all of your experience in technology, emerging technologies, what gets you so excited?
So first, I get my energy from all of you, right? So your passion and enthusiasm about making a difference and a change, that gets me, up mornings, up late at night, figuring out how do we do this, right? How do we get to yes? How do we get it done? So there's that. The other thing is, like everyone else has talked about, AI, artificial intelligence, and the role that it's going to play and how it's going to change the game for us, particularly with the amount of data that we have and what we already know about our patients and our veterans and our service members. And so being able to use that more efficiently, right, to, as I mentioned earlier, provide better outcomes, right, be more efficient and more access to care, but not only that, reducing the administrative burden. So a lot of the things that my VHA colleagues do every day, we shouldn't be doing manually. We should be using technology to do that work. And so this is where AI is going to come in and similar technologies and kind of removing that abstraction and allowing you to really practice at the top of your license and spending more quality time with our veterans and our patients. But the other thing that excites me, and as I mentioned, there's a lot that excites me every day. It's like a kid in a candy store or a toy store. Is where smart devices are coming into the play in medical practice, right? So we didn't foresee this coming. So now seeing the art of the possible where you can use these smart devices with inpatient care as an example, and being able to alert our clinical professionals when there's something happening with the continuous glucose monitoring that a patient is wearing in a bed, being able to use those smart devices to do remote exams for checking for wounds or ear exams, right, and those types of things. And so being able to figure out how do we navigate this process with FDA, with security and NIST, and being able to successfully bring them in to use them, and also partner with the industry on how do we get access to more of those smart devices, because the way that we're using them for healthcare, we don't actually need an iPhone 16. We can use an older version to be able to deliver that. So I'm really excited about continuing to work with a lot of you and seeing what the art of the possible is there in that space.
No, absolutely. It's truly exciting to see how far technology is coming at such a rapid rate. As you mentioned, Mark, even in the past, 10 years, to see how far it's come, and especially in healthcare, how that technology can potentially improve the way we deliver care, the way veterans access care, the way they experience care. I think it's going to be incredible. I know from my own experience with Immersive Tech, the first headset I used was this giant clunky thing with all these wires and a gaming laptop you had to wheel around to different rooms, and now it's like lightweight little headsets that are standalone and no wires, and that happened in a very short period of time. And now as you start to see that kind of technology now integrating with things like artificial intelligence, the sky is the limit, And I think whatever we can do to learn more about these technologies and learn together about these technologies and how it integrates into our systems, I think the better. That collaborative piece that'll make it easier for us to actually take advantage of these technologies to improve things. And Dr. Kirsch, I feel like you're holding your microphone like you want to say something.
Maybe. I want to really springboard off of what you're sharing, and that is really something that is important with all these new technologies. And I know that it's often said, oh, reduce the friction, make it easy. But what does that really mean, and how do we really do that? We're working collaboratively and trying to come up with standards for headsets and the content that goes on the headsets so it's interchangeable. That makes it easy. It's not easy to do that, but we're trying to get that, those of you out there that are in the immersive technology space. And I'd love to learn from any or all of you about how anyone is working to reduce the friction for some of these technologies. That is going to be essential. If there's 10 different pieces of technology for a patient, they're not going to do things 10 different ways, right? It's up to us to think about how to do it smarter, not making the patient work harder. So that's something that I'm still curious about and want to explore. Go ahead, Mark.
I'll just say, and that work that you're calling out, the standards for particularly immersive technologies, when you say we, that's a perfect example of work that we are all doing. Every office in this panel is deep working together to try and make the experience easier, make it better, and frankly lead the whole industry, trying to make this happen. So that's how we can do these things, which is so incredible.
Yeah, I think that's a perfect example of the collaboration happening. So I'm going to switch it up just a little bit. So I've had the absolute privilege over the years to be involved in OHIL and innovation in many different ways, as an investee, working as an innovation specialist, and all the other, working with the amazing innovation specialists within iNet, diffusion specialist, and Shark Tank. I've gotten to interact with a lot of different things, and all of those things are represented here at this conference, and I really hope everyone takes advantage of that and learns a whole lot and sees a lot of amazing things that maybe they didn't know about previously. So I'd love to hear from this group of what you know that's at IEX this year. What are you most excited about? What are you most excited about hearing, seeing, whatever it might be? And any of you are welcome to answer.
I'm happy to start. I'm very excited to meet many of you. I hope possibly all of you, but I don't know. It's only 2 days. But the other thing I'll just say is IEX is about innovation, is about collaboration, and I hope that you all are able to see the incredible amount of work that the teams within innovation and learning have done. So Innovation Ecosystem, Simlearn, Office of Advanced Manufacturing, CCPI, Center for Care and Payment Innovation. Just incredible work. And many of the folks that lead and are part of those teams are here. They've really made this special, including all of you. So please use this time talk to people, go to the booths, look at the posters, make a new friend, and collaborate. That's the most exciting part. And we'll see you next year.
I would say besides this panel, I've always enjoyed the Shark Tank pitches. Those are always fascinating, just to kind of see how the frontline leaders are able to come up with some creative ideas and innovations to help either the care team and or veterans in the day-to-day lives. So I'm really excited to really witness that again this year.
For me, it's being able to come from behind my computer and email and Teams and actually have conversations with real people, right? So I can have a really quick conversation, as Susan and I did this morning, where we're able to exchange information and strategy and start a process just right here in a short period of time. And doing that with as many of you as I can as possible, right? So that I don't have such a large email backlog, and we're able to actually get some things started and moving and get you connected with where you have pain points and getting those resolved here while I'm on the ground. So looking forward to talking to as many of you as possible and seeing all the great innovations that are here at IEX this year.
I'm also happy to connect with this group and those of you that I know, some of you that I have yet to meet in the next day or so. But I really get excited by seeing some of you connect and new ideas get sparked, or hearing about that from others. Maybe one of our group learns about it and shares that with me, because those are the relationships and collaborative pieces or ideas that can continue to make us move along before next year's IEX, right? It's like telehealth in a way. During the pandemic, I definitely did not want to go anywhere to see any type of doctor whatsoever, and got very comfortable with a virtual visit. But at some point, it kind of trails off, and you need to actually see someone in person and talk to them in person. And use this opportunity, because we are in a tight budget year, and we may not have conferences every week or every month, and it is really your time to be able to connect and think outside the box with somebody. It could really lead to the next great thing that VA is doing, like you did, Caitlin, in Asheville, from that surgeon saying, hey, I heard about this, right? And now Immersive Community of Practice has over 3,000 people that are participating and excited and engaged, and I think that you all got about 200 headsets in the last 2 days, right?
Yep.
And they're gone.
Yep.
They
were distributed in about 6 hours.
In 6 hours. So that shows you from some early innovation done by Caitlin and Bailey that is now across the organization, and how much there's that demand. And we are setting pace for not just in VA, right, Mark, outside of VA with some of the standards. So just small collaborations and chatting with someone while you're getting coffee could really lead to something amazing. I truly believe that.
Absolutely. Now, many of you have actually entered some questions into the app for this conference, which I'm grateful for. So I was going to read at least one of those from our audience and have you all kind of comment on that. So I think this one is a really good one, considering where we are right now today. So they ask, VHA has led the way in healthcare in so many areas over the years. What are some ways we can generate enthusiasm for the new generation of VA staff to carry on the rich history of VHA past? I mean, somebody really thought about this one. That was a good question. What do we think?
So I'm going to jump in here. So I've had a recent experience where, I think everyone in the room knows that we are a teaching organization, right? And so most of our medical professionals rotate through VHA at some point in time. So someone that I know personally recently engaged with a VHA as they're starting their journey in the medical field, medical school. And the comment that was made was, wow, you all really need to do something about your systems, right? It's like, yeah, you're preaching to the choir. I kind of know this. But the fact that we also have a lot of our doctors, our medical professionals that are still affiliated with those medical schools, and they're doing things in that position and bring them into VA, where we're able to kind of close the gap there and being able to take advantage of artificial intelligence and large language models and doing experiments and piloting things in VA that are helpful in academia and the rest of the world, right? So I'm encouraged by that, and that we are still in that space actively. We're bringing it into VA, right, as well as sharing it across the world about what we're doing with those experiments and the results. So our up-and-coming medical professionals and those that are rotating through are able to participate in this exciting technology that we're bringing and leading the way in.
Yeah,
Yeah.
And I don't know if everyone knows, but the office that Dr. Clancy leads, and I'm her deputy, is Over Health Professions Training. And it's thousands and thousands of trainees. Carolyn could probably quote the exact number, but it's somewhere like over 30 different types of health professionals. And I think one other statistic is that over 70% of all physicians have had training in a VA. You might know the nursing training specifics there, Caitlin, but I think that that is an area that is ripe for innovation. Think about how we can improve and do things better. And my answer then, shifting to the question, is really to respond and to share stories for the new generation of things that can inspire them. Stories where any one of you have started something and it became a local way of delivering care or doing business, or even in a visit, or even perhaps national. But it's the stories that I think resonate and that people remember, and that's my experience. And it's a way to maybe quote Mark and say, you know, the hopes, the bets, the dreams, and be the next thing that VA does that is the way that we in the country do the work we're doing. And the electronic health record was another one 25 years ago.
The EHR, I think it's, you know, I'll just foot stomp that. I think it's hopes, dreams of the future, right? That's why innovation, I think that's why we exist. Someone has to, we all do this. But I think we have a unique position being the Office of Healthcare Innovation and Learning, being seated within so close to both education, research, being able to work with groups like Digital Health Office and OIT and Octo. We have to be able to support hopes, dreams of the future, because who else will, right? Like, I think it's us. And, you know, I saw so many hands raise up saying that this is the first IEX. So I think you all can also help us with this. If just each of you just tell 2 more people about the incredible things you see that we're doing, especially when times are tough like now, just globally in healthcare, we can still support that mission, and we can still do incredible things. And that's how we grow this. That's how we get people to know. It's because of the work here.
Thank you all for that. Yeah, I think it's really important for our employees, the front line, to understand that, you know, in innovation, we don't have to live with the status quo. That if you join the VA team, it means that you have the power and the privilege to think about how things could be better and actually participate in the practice of making it better, not just from a top-down approach, but also from the ground up, and leading it from the front line and saying, we can do better, and we're going to do better, and we're going to do it together. You know, that is huge to be able to have that ability, because I don't know about you, Dr. Zhang, like when I worked outside of the VA, it was not the same culture. Myself as a nurse, I did not have that same ability. And then coming into the VA, which was one of the main reasons why I came into the VA, was that feeling of like, yes, like it is a shared governance, shared culture where we get to do this together, and it's incredibly important.
Can I just make one final plug?
Absolutely.
Because I think, you know, I think that one of the things that we want to do in Office of Healthcare Innovation and Learning is make it so that folks in the field can reach out to innovation. We want to make it easy. If you have an idea, we want to help you. We might not be able to make your idea a $1 kind of company, but we want to listen to you. We want to help you. We want to hear you. And direct you to resources, give you advice. That's part of the work of innovation. So if you go to innovation.va.gov and go into Pathfinder, if you work for the VA, there's a new feature we've created called Contact Us, and you can actually get a hold of someone. So if you're interested, you have an idea, you want to reach out, Dave Brimmer is right in front, leading the effort with Pathfinder. We want this work. We want you all to be able to reach out so we can help you. Because at the end of the day, the ideas don't come from central office. They come from the field. And that's how we support.
Yeah, absolutely. Well, thank you all. I know we are at time, but this has been an incredible conversation from all of you that are such, like I said at the beginning, rock star leaders within this organization that really helped to facilitate this collaboration across the entire VA enterprise, and we're so grateful to you. So thank you. Thank you for being here, and thank you for being on our team.
Thanks, Kate.
for having
Thank you.